Introduction to the Cancer Care Map. So just in terms of housekeeping, as you probably have just seen there, the meeting will be recorded and will be circulated afterwards with the slides. I've introduced myself, and in a moment, Paula Hagedon and Robin Pritchard, who are the co-directors of Cancer Care Map, will also introduce themselves. They will be doing the lion's share of the presenting today. Just in terms of some housekeeping, everybody will be unmuted. If you notice that you're not muted, please do mute yourself. We will take questions at the end. So I'll be, so just pop those into the chat function. For those of you who are not familiar with Zoom, if you sort of hover your mouse at the sort of bottom, just above where your icons are at the bottom of your screen for your normal computer, a bunch of icons will pop up. You'll see one that says chat, click on that, and just as it does in Teams, you'll be able to enter your question in there, and I'll collect those for the end. If anybody's finding that their slides are being covered up by the pictures of people at the side, if you go to your top right hand of your screen and hover just below where the cross button is, a little icon which says view will come up. And under view, you have the options of side-by-side speaker or side-by-side gallery. What that will do is squish the slides over and just give you either the speaker on the right-hand side or everybody else on the right-hand side, but it means that your slides won't be covered up. I think that is everything in terms of housekeeping. So if we just slide onto the agenda. What we'll cover today is, like I say, this is an introduction to Cancer Care Map. So Paula and Robin will lead off with showing you a video that you can see on YouTube which is about Cancer Care Map and a video for users. They'll then talk you through Cancer Care Map in more detail. And like I say, I'll be collating in the background any questions for the Q&A after that. And then I'll just steal a few minutes at the end to take you through some other health and wellbeing resources and training that we can offer to you. And then we will close. We'll be no more than 1 hour. We may even be a little less than that. So we'll definitely be finished by 2 o'clock. So without further ado, let me hand over to Paula and Robin.
Hello, thank you, Steph. I'm Paula, and I'm one of the directors with Robin of Cancer Care Map, and we manage the Cancer Care Map project. So thank you to Surrey and Sussex for inviting us today. I'll hand it over to Robin.
Thank you. So I'm Robin. So as Paula said, we run the charity together. So apologies really to anyone who we've met or spoken to before. But yeah, as Paula said, thank you for the opportunity to come and talk to you today. So first of all, we'd like to start by showing a short film that explains very simply how Cancer Care Map works.
Cancer Care Map is a free-to-use online directory of cancer support services in the UK, providing you with trusted information that's regularly checked and updated by our team. It's so easy to use. Simply type in your postcode or place name to find out what's available near you. You'll find everything from local hospitals and NHS services to charities and organisations offering practical and emotional support that you might not even know were there. You can widen or narrow your search by area, or add keywords to help if you're looking for something specific. You'll find information on support for families, loved ones, and carers, as well as those living with cancer themselves. You can also include national organisations in your search, ensuring you'll always find support, no matter where you are. Organisations like Maggie's, offering support, advice, groups and classes in their beautiful centres all across the country. Or the Sunflowers Centre in Liverpool, who run counselling, complementary therapies, exercise classes, support groups, and art and craft therapies. And charities like the Cinnamon Trust, who have a network of volunteers and pet foster carers if you found yourself in need of help with your cat or dog. There's also a blog page that throws the spotlight on different regions around the UK and brings together useful information on specific types of cancer or types of support. There are thousands of national and regional support organisations listed on Cancer Care Map, providing psychological and emotional support, health and wellbeing services, and practical help, wherever you are in the UK, whenever you need it the most. Put in your postcode and find out what's there for you.
So hopefully that gave you a bit of an overview as to what Cancer Care Map is. So we are the Richard Dimbleby Cancer Fund, set up in 1966 following the death of broadcaster Richard Dimbleby, and the charity's worked in the field of cancer care and support, predominantly through the work of Dimbleby Cancer Care at Guy's and St Thomas's in London. Next slide, please. We began developing Cancer Care Map in 2015, and it very much came about through personal connections and people coming to us at Dimbleby Cancer Care at the time and asking us how they would find out about support that was available where they were. So we commissioned a piece of research with Guy's and St Thomas's, and it became clear that although other charities do provide some signposting, there was no single comprehensive, independent, standalone directory of cancer care and support services in the UK. So we did some further research and worked with some user groups that included not just patients, but also carers and healthcare professionals. And the pilot site for Cancer Care Map was launched in 2018, and it became the sole focus of our charity in 2019. Next slide, please. So we now have over 3,400 organisations listed on the map, both local services and national services. And in the last 12 months, we've had over 179,000 visitors to the site. The key thing really about what we do at Cancer Care Map is that all information is checked and verified by our team of content editors before it being added to the site to ensure that all information and all services are operating within NHS guidelines for patient safety. And I think that's really key to know that the information that you find on Cancer Care Map is trusted. Also, all information is then checked and updated every 2 to 3 months. Whenever you create a directory, it goes out, especially in today, it goes out of date very, very quickly. So it's really important that we do those checks, especially over the last sort of two years, as so many services had to change the way they operated due to all the COVID restrictions and lockdowns. And many organisations now are offering hybrid support, so online support as well as face-to-face. So that regular checking is really key to what we do. Next slide, please. So the site is aimed at providing vital information for patients, carers, and healthcare professionals who are looking to signpost support services. We can help you connect with third sector support that you might not be aware of. And one of the things we hear so many times when we're talking to healthcare professionals is that people are aware very much of services that are offered within their trust, but they're not necessarily aware of those third sector support available in the community. Also, patients often travel quite a distance sometimes for treatment at sort of main hospitals, and you're not going to be aware of the support that might be available to them sort of in their home setting where they live. So again, Cancer Care Map is able to offer that breadth of information. We're a small organisation and we rely very much on collaboration. We work with all the major charities and support organisations across the country, including Macmillan and Maggie's. Next slide, please. We also work very closely with the Cancer Alliances. We're beginning to develop analytics data to be able to report on user behaviour and show trends in what people are searching for. Also, whether people are searching for things that they're not finding information on, which is really key to feed that information back to the alliances. We received funding from NHS England in 2021-22, and that enabled us to make more people aware of Cancer Care Map, so help connect with families and carers who can then help us reach those living with cancer who aren't necessarily online themselves. Next slide, please. We know that there are thousands of support services out there and support that goes way beyond initial diagnosis and treatment. But what we hear time and time again is that people simply aren't aware that that support is there. We know that at the start, people are often overwhelmed with information when they're initially diagnosed and they don't take it in. There are also health inequalities that need to be addressed. And one of the things that we're really keen to understand is what the barriers are to accessing support, whether that's socioeconomic, educational, cultural within your region. Or we also know that we've heard this time and time again, people have one negative experience of support, either attending a support group that isn't quite right for them or reaching out to an organisation that perhaps isn't as helpful as they could be, and that puts them off. But people still feel alone and unsupported, or that help isn't here for them. and not just patients, but those caring for them as well. So that's where Cancer Care Map can come in. And it's about, quite often, it's about gently reminding people all throughout at sort of various periods in time that support is there when they need it. Next slide, please. So Cancer Care Map can help connect people with the support they need when they need it most. And we want to work with you to make sure more people are aware of Cancer Care Map and the support organisations that we signpost to. We want to connect with patient groups, clinical teams, primary care, health and wellbeing forums. It's just about getting in front of people and reminding them that support is out there for them. Next slide, please. We've developed a number of resources that can help promote the work we were doing, the work that we're doing, that we can share with you. A toolkit really of graphics and videos, patient stories. So we're very happy to share that with the group after this to help you promote what Cancer Care Map is. And the final slide is really just to say, please do get in touch. As I said, we're very, very small. Paula and I head up the organisation. We then have a very small team of content editors who keep everything up to date, but it's just us. And so because of that, we're able to be really agile. So if there are services that you know about in your area that you can't find on Cancer Care Map, get in touch with us and we can reach out and get that information on there. Equally, if you ever go onto Cancer Care Map and there's something that isn't quite working properly or something that you think would be a good idea for us to add, please do get in touch. Our contact details are all there and we'd be really happy to hear from you. Thank you.
Thanks, Robin. Thanks, Paula. So I haven't got any questions in the chat at all. So has anybody got anything that they want to ask? If you could type it quickly. The other thing I was just thinking, Rob and Paula, whether it's possible for maybe you to do a quick live demo of the site, if one of you's feeling brave enough to pull it up and start sharing, if that's not too much of a on-the-spot request.
Sure, bear with me.
While Robin's pulling that up, I'd also like to say that we mentioned there that we work with all the cancer alliances and we're sort of always gathering feedback. And if you use Cancer Care Map, as well as letting us know about services you think need to be on there and that aren't there. If any time a search doesn't work how you think it should, or you think something should be slightly different, if you just send us an email, we will get on it straight away. And that's what's so important to us. It's that constant collaboration and keeping it up to date, because what's key to Cancer Care Map is that it's always up to date. So that every 2 to 3 months check, but also to make sure that the search is constantly performing in the best way possible. So we really, really value your feedback and opinions. Things are working well and things that aren't working well.
So I'll just share my screen with you now. So this is the website. So it's all very, very simple. We tried to keep the front page very, very simple. In previous iterations of the site, we had quite a few different drop-down menus and things available. And actually what we found again is that especially if someone's coming looking for support for the first time, they might be slightly overwhelmed if they feel they have to fill in too many too many things. So I'll just put in random postcode. So you literally just type in your postcode. You can then put in all kinds of keywords. You can choose to include or exclude national services. And that's key because I think especially with some of the sort of rarer cancers, actually it's the national services that are perhaps the most useful place to go. I'll exclude them for now. You then just click Find Services. And it then comes up with all the services in your area that are based on your search criteria. It shows them on the map as well. So it organizes them first in terms of relevance. So we put in family as our keyword. So again, it will bring up all those services that are there for you. And then when you click on an organization, you find that information is all presented in a very clear, simple way. And it's about accessibility and making sure that it's really simple to understand what's available, whether it's available for you, what the referral processes are. And we keep the key information there. And we try and keep information really simple because it's about sort of picking out that key information so that you can decide straight away. And then you can click straight through to the website or you can contact the organization there. We also have quite an active blog page, which we mentioned. So we do city spotlight. So we can either do blogs that sort of focus on certain areas around the country to show the services that are available, or that pick up on certain types of cancer support, or certain, again, one here on sort of cancer and money worries, which is obviously quite key at the moment. And again, we're always looking for ideas and guest blogs to go on the on the blog page. We've got a bit further information here as well that gives you some sort of background information on the types of support that might be available. And if you're a service and you want to put your information onto Cancer Care Map, you simply click Add a Service, fill in all the information, and then we'll get back to you once that information is put on there. So hopefully that explains a bit more about how it works. But it's the key to it, it's that it's really simple, and we're very much focused on keeping that information up to date. We also do have, you can download it as a desktop app, either on your laptop or on your mobile phone as well. So there's a little icon that appears that you can then just access Cancer Care Map straight away.
Robin, it might be quite interesting if we just put the whole region, Surrey or Sussex, in and see, sort of show sort of the services that come in. You can look at the whole region.
So we can see we've got 525 support services across Surrey within a 30-mile radius, essentially, of Surrey. And again, you can roll over them to see what their names are, or you can just do it by list as well. And if you put a specific postcode in as well, it will also do it in terms of a distance to you. So you can see, again, and sometimes it's about just sort of scrolling through, and then there might be types of support that come up that you just hadn't even considered, whether that's practical support, help with travel, help with looking after pets, help with children and families, benefits advice, all those kind of things.
Fantastic. And also just to say, on every care provider, if you click on one of them, you'll see the last time it was updated in the bottom left-hand corner. So you'll know the last time that was, so there we go, that was 16th of October 2022. And that's kind of what really sets Cancer Care Map apart. Okay, so we have a couple of questions. So some thanks for people that have used it and said that it's a great service. A couple of requests for the flyers and the leaflets that you've mentioned. I don't know whether I know you said you would circulate those later. I don't know if those are on the website that you can show people what's available.
Yes, with those, do you just drop us an email? Our email address is it's robin@cancercaremap.org or paula@cancercaremap.org. If you just drop us an email, and we just need contact details and where you'd like us to send leaflets to. They're pre-packaged in packs of 200, but we can get those sent out to you straight away.
And we can also share the digital version of that potentially after this call.
Yeah.
And so you can have the digital version of the patient leaflet as well.
Lovely. So there's a question I know you've mentioned about the national sites, cancer sites on this, are the national cancer charities on this site? So do you want to just
yes, so we've got regional and national charities on there, and again, and if an organisation has sort of a national offering, so it's got a helpline or online support, we will have it listed as a national support service. If it also has additional sort of hubs around the country, different places, we will have those listed separately so that it comes up in the searches multiple times.
Lovely, thank you very much. Any other questions from anybody? So some people have already used it. Some are saying that that's excellent. They can't wait to use it with their patients. Any other questions? No, we are ramping ahead. We're going to be massively ahead of time. So let's move on back to the slides, if that's okay, please, Marissa. Lovely, thank you. So there's just a few slides from me at the end. I just wanted to highlight some other resources and opportunities and training that are available. I've just spotted a dreadful typo in the title of that slide. Sorry to those who are in primary care. It should be not primary wear. There is a further webinar. Thank you, Marissa. Wow, real-time changing. I've been asked to highlight to you a webinar that is available through Eventbrite, and it's for those professionals who are interested in or passionate about cancer care in primary care around the additional roles reimbursement scheme. So those of you who are cancer care coordinators, social prescribers, care navigators, health and wellbeing coaches, or other admin roles. So it's there to discuss cancer prevention, healthy lifestyle promotions, cancer awareness, screening, early diagnosis, safety netting, quaff. I don't know what IIF is, but there's and other ways to support patients. So that's on the 24th of November. So please do sign up for that. It's free, as I understand. And then next slide, please. So on the other thing I wanted to bring to your attention is on the Surrey and Sussex Cancer Alliance website. We have now got a suite of health and well-being videos. There are 9 videos. They're short bite-sized films. They're no more than sort of somewhere between 2 and 5 minutes long. And they are from professionals across the Alliance, covering areas around, how do you manage fatigue when you're undergoing cancer treatment. Other ones are around food and nutrition. Other ones are around managing your mental health. So there's some fantastic little videos on there. The link to the website is on this bottom slide. And there's also a downloadable poster, which is highlighted here on the screen, which has got a scannable QR code, which you can put up in your practices or units or centres for patients to see, so that they can access they can get the link to the videos online. So please do download that. And the next slide is, thank you, a couple of other training resources around personalised care more widely. So colleagues at Macmillan wanted to make you aware that their learning development hub is available to all professionals that are working in cancer. It's not just a Macmillan funded posts, and that you can sign up to their hub by selecting the wider cancer workforce link. There's a huge variety of courses available on there, and the one that they particularly wanted to call out today is the Supporting Cancer Care programme. It's designed for nurses, healthcare assistants and support workers who are new to cancer care, but would be useful for anybody, I think. And then there is another resource from Guy's Cancer Academy, which is an online guide to conducting care and support planning for people with cancer. That's also been done in conjunction with Macmillan, and the link is there as well. Marissa's been posting those in the chat, but once again, I can send out these slides with the link to the video at the end of the presentation. I'm just going to do a quick scan of the chat just to see if anything else has come out. Yes, so Keely has just posted in the chat there. Keely is our Surrey and Sussex Cancer Alliance comms lead, and she said there is a link directly to the cancer care map on the same health and wellbeing page that I've just mentioned. Okay, and Robin has also given you his email again to say that if you want leaflets, please contact him direct, and they can send out actual proper printed leaflets to you rather than having to print those out for yourselves. Okay, the link for the personalised care planning doesn't work. Can I just ask Cara, if you could just, if Marissa's picking that one up with you in the background, perhaps if you could just tell us exactly which link it is that doesn't work for you. Okay, are there any other questions? Because we are pretty much at the end. Marissa, if you could just slide up, put the next slide up for me, please, that would be great. So it's been brief, which is great because it means you get half an hour back on your lunchtime, but we'd love to hear how you found the session today. There's a link there to the Microsoft Forms feedback form that will just pop up, or you can use a QR code if you want to scan that. But we'd love to hear what you thought about the webinar, and also give any feedback to Cancer Care Map as well. And then the final slide is just to say thank you for your time today. Hope that you found it useful. Hope that you'll find that it will support your conversations, HNAs and personalised care and support plan conversations with your cancer patients. If you've got any questions, you can contact myself through the Alliance website, Alliance email, which I've just put there, and also for Cancer Care Map, there's also contact there. Thank you all for joining us, and I hope you found it useful. All right, cheers. Bye-bye, everybody.
Thank you.
Thank you.